It's interesting how people know their drugs, and they often know them by the colour or the shape, and as doctors we don't. And so it's important that you know what the name is, that you know how much you're taking, like how many times a day, and also what the dose of the medication is, because medications come in lots of different dosages. So if you can record that either in some diary somewhere on your phone, take a photo. If you've got a portal, take a photo of the portal that's got all your list of medications on it. Just have a list somewhere that you know is available to you. Lots of people will carry a little card in their wallet with the medication on, but it needs to be very clear that it's the names, the doses, and how many times you're taking it. If patients have any medicine that's need to be kept in the fridge or chilled, then what we'd suggest you have is ice packs in your freezer ready to go so that they're available if you need them. Maybe have a chili bin or a polystyrene bin that you can put a few things in, and often those need a little bit of packing around them because you don't want to put the medicine onto the actual ice pack. We always recommend that someone would have 2 weeks worth of their medications and when they need to get a repeat of the medication. It's a little bit tricky if they're controlled drugs, but we try and keep people a little bit ahead of the game. Also, we would let people know if their medication is in short supply, or if they need to make sure that their medication is essential to them and that they can't stop it. So there are some medications you wouldn't want someone to stop, and we'd let them know that they have to be on it all the time. So for most controlled drugs, if someone's on a controlled medication, you would have a supply that would, usually you can get a month's supply at a time. So when you're getting towards the end of that month's supply, then make sure that you can go and pick up your next repeat. So if patients talk to their local pharmacy and work with them on what they need to absolutely have for the first few days, especially in an emergency. So there'll be some medicines that they must keep supplies of, and then there's other medications that they may be able to do without for a few days. And then the pharmacy can make sure that they've got their repeats on time and that they're getting the supplies up to date. And then the patients would have to liaise with their doctors if that prescription is starting to run out. So asking your pharmacy what you have to have is really important.